7 signs of high cholesterol. Have you ever noticed little bumps around your eyes or tightness in your chest and thought, that's odd? Cholesterol isn't just about diet. It plays a big role in your body's overall function, from building cells to producing hormones. But when cholesterol levels get out of balance, your body starts sending some unusual hints. Nearly 1 in 3 adults in the United States have high cholesterol. That's a staggering number, and many don't even know it. This might sound controversial, but your body actually needs cholesterol to function properly. However, too much of the wrong kind, LDL, which means low-density lipoprotein, also often called bad cholesterol, can clog arteries and cause serious health problems. This includes heart disease and stroke. On the other hand, HDL, high-density lipoprotein, or good cholesterol, helps remove excess cholesterol from your bloodstream. When the balance is off, you might start noticing some unusual signs, some of which show up in surprising places. In this video, we're going to uncover 7 surprising signs of high cholesterol that you absolutely should not ignore. Watch till the end because what you learn today could be a real game changer. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. Number 1, small yellow lumps near the inner corner of your eyes. One of the most telltale signs of high cholesterol can appear right on your eyelids. These are called xanthelasmas. They're small, yellowish, cholesterol-filled bumps that form near the inner corners of your eyes. Now, before you panic, xanthelasmas themselves aren't harmful. They don't hurt, itch, or cause vision problems, but they can be a warning sign that your body is struggling to process fats properly. Xanthelasmas form when cholesterol builds up under the skin, typically in people who have high LDL cholesterol. While these deposits themselves aren't dangerous, they often signal an increased risk of heart disease and stroke. If you notice these yellowish deposits forming, it's a good idea to get your cholesterol levels checked. While they can be removed through minor surgery or laser treatment, the underlying cause, high cholesterol, needs to be addressed to prevent further issues. Before we move on, don't forget to hit the like button, subscribe for more health tips, turn on your notification bell, and share this video with someone who needs to hear this. All right, moving on. Number 2, yellowish lumps or patches on the skin. So we've talked about those yellowish bumps near your eyes, but did you know that cholesterol deposits can also show up elsewhere on your skin? That's right. These fatty deposits create yellowish bumps known as xanthomas. They may look like small pimples, plaques, or nodules and can range in size from tiny specks to larger raised growths. In addition, they're often found on the elbows, knees, hands, feet, or buttocks. Xanthomas are caused by an excessive amount of cholesterol circulating in the blood. This condition is more common in people with inherited high cholesterol, familial hypercholesterolemia, but anyone with uncontrolled high cholesterol can develop them. Now, just like xanthelasmas, xanthomas are painless and harmless on their own, but they indicate that your blood lipid levels are dangerously high. This plaque buildup, known as atherosclerosis, is what narrows and hardens your arteries, increasing the risk of cardiovascular disease. If you spot these on your skin, don't ignore them. They could be signaling bigger problems inside your arteries. Number 3, deposits in a half-moon shape on the cornea of the eye. So, if you're looking in the mirror, maybe you're taking out your contacts or putting them in, and you notice this ring-like shape forming around the outer edge of your cornea, which is the clear part of your eye. That, my friends, could be corneal arcus. This ring-like shape could be white, gray, or yellowish in color. In simple terms, corneal arcus happens when cholesterol, fats, and other lipids build up in the outer edge of your cornea. Think of it like tiny little deposits forming a ring. This relatively more common in older adults and could be harmless. But if you're under 45 years old, it can be a warning sign of high cholesterol. This is why it's super important to get regular checkups with your doctor. Number 4. Swollen tendons or bumps around the joints. Okay, let's talk about something that might seem a little strange at first. Have you ever noticed any bumps around your joints, especially your knuckles? Or maybe your tendons seem a bit thicker or swollen? One possibility is something called tendon xanthomata. Cholesterol doesn't just affect your arteries, it can collect in your tendons too. This condition causes firm, yellowish lumps to appear on tendons. These lumps are made up of cholesterol deposits that have built up into the connective tissues of the body. These are tough cords that connect muscles to bones, and they often show up as firm, yellowish bumps. And they're most common on the Achilles tendon at the back of your heel, the tendons in your hands, especially around the knuckles, and even on your knees. If your tendons feel thicker than normal or have visible bumps, it could be a sign that cholesterol is being deposited in the wrong places. This symptom often appears in people with a genetic condition called familial hypercholesterolemia, which causes extremely high cholesterol levels from an early age. Left untreated, it can lead to early onset heart disease or stroke, sometimes as early as a person's 40s. Seeing a doctor for cholesterol management is essential if you have these types of deposits. The sooner you identify and manage high cholesterol, the better your chances of preventing complications and living a healthier life. Number 5. All right, gentlemen, let's talk about a topic that might be a little uncomfortable, but is incredibly important: erectile dysfunction, or ED. Now, we all know that ED can be caused by a variety of factors like stress, anxiety, or certain medications. But did you know that high cholesterol can also play a significant role? That's right. High cholesterol can damage your blood vessels, including those that supply blood to your genital area. Here's how it works. An erection occurs when the blood vessels in the penis dilate, allowing increased blood flow. But if cholesterol builds up in the arteries, it can make those blood vessels narrow. This reduces blood flow, not just to the heart, but to other parts of the body too, including the penis. When there isn't enough blood flow, it becomes difficult to get or maintain an erection. In fact, erectile dysfunction, ED, is often an early warning sign of heart disease. Now, this doesn't mean that every case of ED is caused by high cholesterol, but if you're experiencing persistent erectile issues, it's worth checking your cholesterol levels as well as overall cardiovascular health. Number 6, increase sensitivity in the abdominal area. Let's talk about your gut. You know that feeling you get after a big meal? Now imagine that feeling, but it's not going away. If your belly feels more tender than usual, or you experience unexplained stomach pain, it might be linked to high cholesterol. Excess cholesterol can affect the liver and gallbladder, leading to problems like gallstones or fatty liver disease. So why does this happen? Gallstones form when there's too much cholesterol in your bile, which is the digestive fluid produced by the liver. This can cause discomfort in the upper right side of your abdomen. You could also experience nausea, bloating, changes in your bowel movements, and even vomiting after fatty meals. The liver plays a crucial role in processing fats, and when cholesterol levels are too high, fat can start accumulating in liver cells. This can lead to inflammation and potential liver damage. If you notice frequent digestive issues, your cholesterol levels might be the problem. And if left untreated, cholesterol-related liver problems can contribute to serious complications. Lastly, number 7, chest pain. Now, I know this one might seem scary, but it's important to understand the connection between chest pain and high cholesterol. Chest pain or discomfort, especially after physical activity, is one of the most serious warning signs of high cholesterol. This can feel like a tight, squeezing, or burning sensation in the chest, and it often gets worse with physical activity. It can also feel like indigestion or heartburn. The important thing to remember is that any type of chest pain should never be ignored. As I've said before, high cholesterol can lead to a buildup of plaque in your arteries, including the arteries that supply blood to your heart. This buildup causes your arteries to become narrowed or blocked, restricting blood flow to your heart, leading to chest pain or tightness, also known as angina. Over time, if cholesterol levels stay high for too long, plaque can build up and form clots. They can rupture and can completely block arteries, increasing the risk of a heart attack. And when it comes to your heart, you never want to take any chances. Even if you think your chest pain might be due to something less serious, like heartburn. It's always best to err on the side of caution and get it checked out by a medical professional. So let's say you've been diagnosed with high cholesterol. What's next? Well, the primary focus of treatment is, you guessed it, managing your cholesterol levels. Now, just like with the other conditions we've discussed, managing high cholesterol often involves lifestyle changes. Start with eating a heart-healthy diet that's low in saturated and trans fats. In addition, get regular exercise, maintain a healthy weight, and quit smoking. These changes can go a long way in improving your cholesterol levels and your overall cardiovascular health. In some cases, your doctor might also prescribe medications to help lower your cholesterol. These medications work in different ways, so it's essential to discuss the options with your doctor to find the best fit for you. The more you know and understand the signs your body is sending you, the better equipped you are to take the first step towards taking control of your health. And there you have it, 7 signs your cholesterol is too high. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.